We all know that we've reached a crisis point across the NHS and care sectors, with more patients than ever waiting for treatment, and it's not just affecting those who are in need of care and treatment, but also those who work tirelessly across the NHS and care sectors who are feeling the full brunt of the crisis. The Conservatives' legacy of hours-long waits for ambulances, treatment in crammed hospital corridors, captured in horrifying detail by the Dispatch's documentary which looked into the hospital that serves my North Shropshire constituents, and communities grinding to a halt under the weight of all sorts of different waiting lists and backlogs. We need urgently to move forward. Now, the Secretary of State has repeatedly outlined the need to shift from treatment to prevention and from hospital to community. And Liberal Democrats absolutely support him in that endeavour, and indeed we called for many measures that would achieve that shift in our own manifesto. Stronger primary care, stronger community services were the strong recommendations of Lord Darcy's report, which had been commissioned by the Secretary of State and have been broadly welcomed. And indeed, there's been a great deal of consensus across the House today that we need to take those measures. But I fear that these estimates paint a picture of an NHS which is continuing to pour money into the previous failing model, where capital budgets are drained to pay for day-to-day services, where a huge proportion of increased spending goes on NHS staffing, while community care providers and primary care providers wrestle with a huge employers' NIC increase. Combined with the decision to scrap targets on mental health and community services for the sake of prioritising targets on elective care, we must ask the question, when will the stated objectives of the Secretary of State really be matched by actions? These latest estimates are an indictment of the broken state of the NHS after years of Conservative neglect, but we will urge the Government to go further and faster to address the failure. Now, primary care providers are currently on their knees, made worse, I'm afraid to say, by the national insurance hike announced in the budget. They can't meet demand for local appointments even as things stand, and in many cases the constraining factor is the estate that they're operating in. So Prescott Surgery in Baschurch in North Shropshire wants to provide additional services to the community. They want to keep people away from hospital, but their surgery is physically not big enough. A local developer has provided land for a new surgery. The local council has still funding for that building, but it can't be done because the ICB won't pay the notional rent, which everybody has agreed to forfeit. It's crazy, and I hope the Minister can commit to finding some kind of easy solution for that kind of nonsensical situation that we find ourselves in. But I want to come on to community pharmacy because I'm particularly concerned about pharmacies at the moment. Pharmacies are a key pillar of care in the community, dispensing obviously prescriptions, providing over-the-counter medicines and advice, and they're also critically providing pharmacy first. But they are closing at an alarming rate. Analysis by the National Pharmacy Association predicts another 1,000 will close, 900 of them by the end of 2027, if the current rate of closures continues. And that's because of a 40% real terms cut in their funding since 2015. In fact, community pharmacies are essentially subsidising the NHS by making a loss on many of the prescription drugs that they dispense. And they're going to be clobbered in a few weeks' time in April, not only by the NIC hike, but by the increase in business rates that's going to affect high street retailers. Shamefully, they've not even had their funding rates for the current financial year confirmed, the one that ends in 3 weeks' time. And Pharmacy First, the flagship plan to move care into the community, has not had its funding confirmed beyond the first week of April this year, in just a few weeks' time, according to the National Pharmacy Association. So will the Minister confirm in her closing remarks what is the future of Pharmacy First? Is there a funded plan to deliver that service? And what steps are being taken to keep our community pharmacies in business? Because if we want to see care in the community, it's essential that we support them. I just also want to mention dentistry. In Shropshire, Telford and Wrekin, the number of NHS dentists in 2023 to 24 had fallen by 12.3% since 2019 to 20. Many of my constituents can't access a dentist, and the Government has committed to improving this situation. So can the Minister confirm when the negotiations for the new dental contract will be beginning? Now let's move on to social care. The crisis that currently faces the social care system is very daunting, not least because of the additional national insurance hike that will be starting in a couple of weeks' time. Last week, caring organisations launched an unprecedented day of action with thousands of people marching on Westminster to highlight the precarious state of the organisations that provide care. The Darcy review found that people waiting to access social care account for 13% of NHS hospital beds. So we all understand the urgency of tackling social care. But the cross-party talks, which collapsed last week, haven't started. There's no date for a new meeting. There's no published terms of reference. And we think that 2028 is far too late to resolve this problem. So can the government urgently reinstate the talks and act now to deal with this social care crisis? Before I conclude, I just want to talk about mental health. Lord Darcy said there's a fundamental problem in the distribution of resources between mental health and physical health. Mental health accounts for more than 20% of the disease burden, but less than 10% of NHS expenditure. This is not new, but the combination of chronic underspending with low productivity results in a treatment gap that affects nearly every family and all communities across the country. And he's dead right. By April 2024, about 1 million people were on the waiting list for NHS mental health services, of which 340,000 were children. My casework is full of children who wait months and months for the diagnosis and treatment that they need. The government's removed the targets for mental health waiting lists, and I really want to urge them to reinstate them so that we have parity between mental health and physical health in our health service. So, Madam Deputy Speaker, I'm very conscious of time. So, in conclusion, can I just recall our asks to ensure that social care talks start immediately, to deal with this problem with pharmacy, and to make sure that mental health and social care are dealt with equal parity? Thank you.